Welcome to Somerset Medical Center's Health Talk. I'm Dr. John Buchek, Director of Somerset Medical Center's Family Medicine Residency Program. Flu season is upon us once again. On today's show, we're going to learn more about the flu virus, how it is spread, and the best ways to protect yourself from getting sick. We'll also talk about some other common infectious diseases to be aware of, whether you're staying home or traveling this winter. Joining us today is our special guest, Dr. Robert Segal, an infectious disease specialist at Somerset Medical Center. Welcome. Thank you for coming and helping us out.
Thanks.
Let's start with the flu. What is the flu? Influenza? What is it?
So the flu is a virus that's caused by the influenza virus. And we tend to see it more in certain months, more in the winter months. And it infects us through our respiratory tract. So essentially, it's a respiratory illness. You can get it by inhaling it through the nose or the mouth, and it infects the respiratory system. You can get other symptoms involved as well, and it's variable. Some people can have very mild symptoms and just be out of work for a day or two. Others, depending on what other problems they have medically, can get very ill and end up in intensive care unit, and we even see many deaths a year from the flu.
Now, it's a respiratory illness, so it shares a lot of things in common with some other respiratory viruses like colds, but there's some differences in the way it feels compared to other respiratory viruses. Why don't you go over that a little bit?
Right. So what you usually see with the flu is terrible muscle aches, body aches, high fever, and problems with cough and upper respiratory symptoms. You're much sicker than with just a regular common cold. People describe not being able to get out of bed, their head hurts too much, their whole body is aching. And so it's not a cold, which most of the time we can go out and still function in our daily lives. It's not like that. Patients are much sicker when they have the flu.
Some people who we found out later had the flu tell me it was very fast. From feeling well to feeling really badly was much quicker than other illnesses that they had.
Right. It usually hits you like a truck. You could be fine one morning, and then an hour or two later, you just start getting terrible chills, horrible muscle aches, and you can't get out of bed. So the onset is very rapid.
Now, if you have the flu and they determine that that's the case, what part of the illness are you able to give the flu to other people? When are you contagious?
So you're most contagious usually from a day or two before your first symptom starts, believe it or not, up until 5 to 7 days after the illness has started. So that's why it's very important during the winter months that we all take the appropriate precautions in terms of prevention, because you may not know that one of your coworkers or someone in your family is coming down with the flu, and you could be near them just before they get sick.
If you're aware that somebody that you are going to be with or have to be with, like a family member, has the flu, is there medicines you can take to reduce your chance of getting the flu?
There are medicines that you could take. First of all, obviously, vaccination is the most important thing that we think of during this season, because if we vaccinate against this, we don't have to worry about getting it most of the time. But there are prophylactic or preventive medicines that can be given, and that's usually recommended to household contacts who are in the same house as somebody, or people who have immune problems if they're around somebody who then gets the flu.
So you encourage people to think about getting the flu shot. It'll reduce their chances of getting the flu. And if they think they have to be around somebody who has the flu, there's something they can ask their doctor maybe to prevent or reduce their chances of getting it.
Exactly.
Everybody's going to feel poorly if they have the flu, but some patients are more at risk. Their level of illness could be greater. Who are those patients? Who are the at-risk patients when it comes to the flu?
Anyone whose immune system is compromised. And believe it or not, that's a lot of people in society. So first of all, the very young or the very old, young children below the age of 6 months, and anyone above the age of 65, they're at most risk because their immune systems are not as healthy as, let's say, a middle-aged person. Pregnant women, their immune systems are down during pregnancy, and so we've seen pregnant women get very ill with the flu. Anyone who's undergoing treatment for cancer, and is on chemotherapy, people who are on prednisone or other immune suppressive drugs for, let's say, arthritis conditions or asthma. Asthma itself or any respiratory conditions such as emphysema will put people at worse risk of being ill from the flu. And even patients who have kidney problems or heart problems, congestive heart failure, or liver problems. So basically, if you have some other underlying illnesses, you're definitely at risk to get sicker from the seasonal flu.
Now, we talk about seasonal flu. It comes at a little bit of different time every year, but there's sort of a season in the year that's the flu season. Tell us, why is that? Why is it not here all year round? Why is it more likely, let's say, when it's cooler?
Right. So it tends to occur, the flu season tends to occur from October, usually all the way as late as May, but its peak is usually January or February. And the reason that's for our hemisphere, and the reason for that is it does depend on the weather at the time, because when it's colder out, people are inside more. They're more at risk of being in a closed environment where there's more contagious risk, and so that's why we see the flu more in the winter months.
What if they wear a sweater?
Will not make a difference. You don't get the flu from being outside in the cold.
Okay, so it's the time of year, it's being together more, and there's certain places in the world where certain months are the peak.
Exactly.
Okay.
So what's the peak for us is different from the peak, let's say, in Australia, where their winter is during our summer.
Now, if you say, uh-oh, I think I have the flu, and you're waiting to talk to your doctor, or you talk to your doctor, what can you do to help yourself get through it? What can you do to help yourself feel better or to make it less bad of a flu?
So rest, obviously, and don't go out and go to work or exert yourself. First of all, you don't want to
Even if you think you can handle it?
Exactly, even if you think you can handle it. First of all, you don't want to put other people at risk.
Right.
Every time you go to work, you're exposing all these people to the flu. So the best thing to do if you think you're coming down with the flu is to stay at home.
Okay.
And drink lots of liquids so you don't get dehydrated, because when your fever is very high, you're sweating a lot and you may not even know that you're getting dehydrated. And obviously take supportive over-the-counter medications that can decrease your fever to make you more comfortable and to help with dehydration and your heart rate going too fast.
Does it matter? Could it be ibuprofen? Could it be acetaminophen? You're trying to have less muscle aches, less of a fever.
Right. I mean, anything that you've tolerated in the past that will help you with your fever and help with your muscle aches. Some people do find they get some better effect from the non-steroidals, such as ibuprofen.
Or naproxen.
Or naproxen.
Yeah. Now, I've heard people say, I'm going to let myself have the fever. It's going to make things go away quicker.
That's totally not true.
Okay. So it's okay to try to reduce the fever so you can be comfortable. The illness will be the same.
Exactly.
Okay. Now, we talked about prevention medicine. Are there medicines that you can take if you think I have the flu?
Yes. So there are two medicines that have been out for a little more than 10 years now that have become the standard of care to treat the influenza virus. And they're what we call antivirals. One is an oral medication, and the other one is an inhaled medication. So you would actually inhale it through your nose, and it gets right into your respiratory passages to try to kill the virus or slow down the rate of the replication of the virus. One of the medications that you take orally is called Tamiflu, and the medication that you inhale is called Relenza. Now, both those medications are most effective when taken within 48 hours of the first symptom of the flu. They will not completely cure you. What they do is they decrease the length of time that you're sick with the flu, and they also decrease the intensity of the symptoms. So they help so that your symptoms aren't as severe and that you get better quicker.
So if you think you're coming down with the flu, you want to talk to your doctor. Are you one of the people who might be better off if you take one of these medicines?
Exactly.
Okay.
And the earlier you speak to your doctor, the better, because these medications have been shown to work the best when they're taken within the first 48 hours of the symptoms.
Now, if you're somebody who decides, I don't want to have the flu, I think I'm going to reduce my chances by taking a flu shot, where do you get a flu shot?
Flu shots are available almost anywhere. Your doctor, your local pharmacy, there are clinics that are set up in certain townships. And the recommendation now is anybody 6 months or above should receive a flu shot. So it's become universally recommended to be vaccinated now.
Yeah, I also know that it's not just recommended, but it's required. There's certain institutions that you might work, and there's certain institutions where young children might go for daycare, for school, where they have to have the flu shot as a requirement of attendance. So you have to check with each place. It may be a requirement.
So anybody, for instance, healthcare workers need to be vaccinated. We know from working in the hospital that all the healthcare workers need to be vaccinated, and that works differently depending on what kind of facility you're working in. A lot of companies will offer it to their employees because they know that it's going to reduce the rate of illness, and it's quite costly when someone gets the flu, not only from a healthcare point of view, but in terms of days missed at work and productivity at work.
Now. You know, is there any concerns, like they have to make the flu shot different every year, correct?
Correct.
So some vaccines are made and they're more or less the same for years and years and years. Is there any concerns about the fact that they have to make the flu shot new every year?
So what experts do to try to get the most out of the vaccine is the 6 months before the flu season is upon us, they look out in the rest of the world and see what what viruses they anticipate will be coming to the Western Hemisphere. And based on that, they will put those viruses in the vaccine. So usually there's 3 or 4 viruses in the vaccine. Now, the reports have shown that probably out of the last 20 years, about 85% of the time, they've been successful in matching up the right virus to the vaccine. So it's not perfect, but it's the best thing we have right now. And we do know that even if you are vaccinated and a strain comes by that's not in the vaccine, there's some similarity between the genetic makeup of all these viruses that you probably still have some immunity and some antibodies to fight a virus that may have not been in the vaccine.
That's a lot of information about the flu, and for some patients, one of the things that might be confusing is the flu season includes a lot of extra illness from a lot of other viruses. Yeah, you want to just help us understand, we say the flu season, but we have people with illnesses from all other different viruses, RSV, for example. Are there any of the other illnesses that are preventable, or are there any good habits that might help you avoid the flu and the other viruses?
Right. So universal precautions in everyday life are important. Things like washing your hands, not sneezing on your hands, coughing and not covering your mouth. You know, things that you would normally do in everyday life to prevent yourself.
So how do you cough? You know, what's the good medical way to cough if you're sick? Because everybody's going to be sick, and some people are just going to have a cold and they want to go to work.
Right. So the best way to cough is actually to cough into your sleeve like this.
Oh, okay.
They teach you that in
then it's not on your hand, and you're not touching
you're not touching anybody.
Desk or your coworker. And
but it's also important to note that by getting the flu vaccine, you're actually helping yourself prevent other respiratory infections. Because what happens is when you get the flu, even if you recover from the actual flu, it will cause some problems and potentially disrupt your normal immunity that's in your respiratory system, so that you're more at risk of picking up another type of infection right after you've had the flu, like a bacterial pneumonia or a strep infection or other infections that can make you quite ill and make you end up in the hospital.
Have you heard anything about vitamin D, and perhaps in certain areas of the country, infectious illnesses are more severe or more prevalent because of sun? Can we tell patients they should take vitamin D supplements? Do you think that's helpful?
Vitamin D supplements, multivitamins, eating a healthy diet, exercising. I mean, all things that
sleep.
And sleep. All things that we know are important for healthy living for other parts of our body are also important to prevent infection.
Now, we talked about wintertime, common cold, flu, other viral infections that you get. Let's talk a little bit about sometimes people try to get away in the winter, get away from the temperature for sure, maybe the illnesses. Are there any special concerns when patients are traveling? You have a practice where you sometimes help people figure out what they need if they're going to travel to certain parts of the world. Talk us through that a little bit. What do you do? You know, let's say you're going to Florida. Any special preparation?
So if you're staying within the country, obviously, anytime you're traveling on an airplane, a closed space, there's going to be virus going around in a closed space. And again, anyone who's traveling in the winter months should get a flu shot to start with.
Yeah, my patients tell me sometimes they get to their vacation spot and suddenly they got sick. How did that happen? It might be the airplane.
Exactly, it might be the airplane. We see that a lot.
So general precautions and a flu shot no matter where you fly.
No matter where you're going.
Okay.
And then obviously there's other parts of the world. People go in the winter time to the Caribbean, Mexico, other warm climates that are not in North America that have other infections that we're concerned about. So my recommendation would be, first of all, to check with your travel agent or the CDC website and see what vaccines are recommended for wherever you're traveling. You can also consult an infectious disease travel expert who can help you figure that out. And then, in terms of what you need to do, you know, the appropriate vaccine can be offered to you. For other recommendations, I think it's important to remember that if you're going to be in a warm climate where you're outside a lot, to remember to bring along insect repellent, because there are viruses that mosquitoes transmit that we don't have treatment for, especially down in the Caribbean and Central America area, something called dengue fever.
Mm-hmm.
Malaria could be a problem in certain areas depending on where you're going, and for that we can give you medication before you go to prevent yourself from getting malaria, which you can also get from mosquito bites. And there are other waterborne and foodborne infections that are in other countries that we don't see as much of in the United States, and we do have precautions, vaccines, and antibiotics to prevent those.
There's a time concern. I've tried to help patients prepare for travel, and some of them leave it till the last minute. How long should they be checking the CDC website before they fly? How long does it take for the longest preparation scheme? 3 weeks, 4 weeks?
So some vaccines will work as quickly as 2 weeks, but others can take longer. So I would make sure that you take the appropriate precautions and seek medical advice at least 6 weeks before any trip.
And then you get enough time to get advice, to get either the treatment ready or the vaccine ready, and then your body can be as ready as it can be when you get there.
Ready to go.
And when you travel, you know, people try to, you know, push themselves, and maybe they don't sleep so well, maybe they eat a lot of party food. So these are other things that can, you know, make your immune system change as you travel.
That's right.
So, and is your doctor a good place to start? Should you just call up and say, you know what, I'm going to travel to Egypt in 6 weeks? Are they somebody who's likely to be able to tell you what to do? Or should you, you know, look it up yourself? What's a good way to start?
Like I said, there's some great websites. The CDC has a great website which will, if you plug in the appropriate country, it'll give you some recommendations. Or go to a special travel medicine physician that knows exactly what you need and can counsel you appropriately, not only on vaccines, but what other medications you should bring along, what foods you should avoid, how you should treat your body in terms of sleep, and even sometimes if you're hiking in a very difficult area, they can help you prevent altitude sickness. So there's a lot that travel medicine physicians can do to help you out.
Now, I was thinking that in the cold and flu season, some of the infections, some of the doctors are going to interpret need antibiotics. So there's a lot of discussion about which infections need antibiotics. And many of them start as viruses, but then are later determined that there's some bacterial component and an antibiotic would help. When it comes to antibiotics, these are not without risk, right? We have some issues of overtreatment, inappropriate treatment. And one of the places that we see the effects of using antibiotics a lot in this, northeastern United States is in the hospital. And one of the ways we see it is in resistance. So let me take you there and tell me a little bit about some of the concerns that we've heard recently about MRSA. If I have a skin infection, what if it's MRSA? What if I get MRSA? Do I have MRSA on me? Tell me a little bit about that.
So what MRSA means is a resistant staph infection.
Okay.
And we all have staph on our skin. It's part of our normal daily life.
Right here.
If you took a swab and cultured your hand and put it in under the microscope, you would see staph there, but that's normal. That's normal. It's what we call normal flora.
Okay.
MRSA is a resistant type of staph, and we used to only see it in very sick patients in a hospital setting, and we'd only worry about it in terms of transmission within a hospital. But a number of years ago, some other strains of MRSA were found that are more what we call community-acquired MRSA. So they're transmitted within the community from person to person, and even very healthy people will get this type of MRSA. Now, typically this type of MRSA infection will cause skin infections, boils, that can be quite painful, but it can also cause pneumonia and some other type of infections as well. The good news is we have treatments for it, but our real goal is to prevent it from being transmitted. And we'll see a lot of transmission within a family, so if one person in a family has a MRSA boil, another person might get it a week or two later because they share towels or they share the same shower or other household products together. We also see it a lot within sports teams because they're sharing equipment in locker rooms or in gyms. So to prevent all this transmission, there's a few strategies we have, but the most important is to just make sure you wash your hands and you don't share equipment with other people. You go to the gym, after somebody uses a machine, you go and wipe it off with a wipe, an antibacterial wipe.
And I've seen that more, that at exercise facilities, they leave out the stuff to help you do this. It used to be, it would be up to you to think of it, and now it's sort of a standard in many places. They have the wipes, they have the towels, they leave them in places that help you remember.
Exactly, to just better hygiene.
So you keep mentioning washing your hands over and over. It's a big thing in infection prevention, I guess.
It's so easy, and people just forget to do it all the time.
Let's say you get treatment for skin infection. You may or may not know if it's MRSA. Do you have to be worried about people in your family who are ill or old or young? Is there any special consideration there?
Well, again, I think if you take the appropriate basic precautions, meaning that if you have an open sore, I'd be careful about going near somebody whose immune system might be compromised for some reason. But if you cover your sore, you wash your hands, and you take the appropriate precautions, there's no reason to stay home and not go out into society just because you have a skin infection.
Now, we think that some of the reason these things are more common is, I talked about widespread use of antibiotics and antibiotic use for minor illnesses. Do you have any general recommendations or advice for patients who are trying to figure out, because we all want to get better quicker, and if we know that our illness can go away faster by taking something, we usually want to do it. So shouldn't we be asking for antibiotics whenever we have an upper respiratory infection?
Actually, it's a lot of times completely unnecessary, and like you said, it can cause more harm than good. So I think the best thing to do when you're sick with an upper respiratory infection is to go to your doctor, because your doctor should be able to decipher whether it's a bacterial infection for which we have appropriate antibiotic treatment versus whether it's a virus which antibiotics don't work for, and viruses are self-limited, meaning they tend to go away on their own after a few days. A lot of times, like you said, people want a quick answer to what's wrong with them and a quick solution. And they think that if they get an antibiotic, they'll be better within 24 hours. But that's not the case if it's a virus. And they could be exposing themselves to medication that's unnecessary. So really the best thing to do is go to your doctor, let your doctor make a diagnosis and be patient, because if it's a virus, it'll just take time to go away on its own, and your doctor will tell you that, and really don't think that your doctor's wrong for not giving you antibiotics, because a lot of the times they're doing the right thing.
I'm going to try to be patient, but maybe my boss won't be so patient, waiting for me to get better.
That's true, but they have to understand that it's not really going to make a difference.
Okay, so it's a careful decision with each illness. It's not something that helps every condition, and there still are some infections, though, where antibiotics would be a good idea. For example, I think strep throat.
Right.
It's pretty well understood that that's something where you're not only going to feel better, but have less problems later on if you take the antibiotics.
Exactly. Strep throat, which is very common, especially in school-age children, but also in parents of school-age children, because it's quite contagious. And it can, if it's not treated appropriately, it can lead to potentially kidney or heart problems or arthritis conditions down the line. So it's important to treat it.
You can see it from time to time at any month, but isn't there a typical time of the year where we see strep also?
Strep is also more common in the winter months.
Okay. So we covered a lot of material here. Just to review, we talked about the flu, we talked about conditions that may or may not need antibiotics, we talked a little bit about preparing for travel. What things would you think that you'd like to highlight or emphasize for the people listening in terms of what we talked about today? What would be good to remind everybody one last time before we say goodbye?
Well, I think it's important that just like almost everything in medicine, with infections, there is a component of prevention that can be taken to prevent some of these things. Obviously, not everything is preventable, and you may get stuck with being exposed to some virus. But if you get your flu shot, if you wash your hands, if you take the appropriate precautions during the winter months to not expose yourself to certain people who are ill at certain times you can prevent yourself from getting sick with an infection. So prevention with infection is as important as prevention with heart disease or diabetes or anything else in medicine.
Great. Thank you very much, Dr. Segal. It was good to have you, and I appreciate all the answers you gave us, and I think our audience will too.
Thanks. It was a pleasure.
This concludes today's episode of Somerset Medical Center's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 1-800-443-4605. For more information about Somerset Medical Center, please visit somersetmedicalcenter.com. Thank you for watching.